Hey everyone, good day to all. Myself, Dr. AJ Moria. I recently cleared my Fmge examination, which held in July 2020, in the very first attempt, guys. So, guys, in this video, I'm going to explain you guys the top high yield images of the ENT. Actually, my dream is also to become the ENT specialist. Okay, so let's go. So, for this PDF, guys, you can see the link in the description, or else you can just type the Fmge aspirants Dr. AJ in the Telegram. Okay, you can also follow me in the Instagram. Okay, so let's go. First of all, I have to start with the larynx. Okay, larynx. So guys, in the larynx part, guys, you have to first of all just remember this one. Guys. This is a normal larynx. Just remember that which is the true vocal cord, which is the false vocal cord. Okay. So here, guys. So please remember here what are the paid and the unpaid cartilages. What are the paid and the unpaid cartilages? Okay. What are the paid and the unpaid cartilages? So we have in the ETC, etc. ETC, epiglottis, thyroid, cricoid. Okay, these are the unpaid. See, extra, unpaid, ETC, and the paid are ACC, 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 ACC. These are arytenoid, cuneiform, corniculate. These are the paid cartilages. Okay, now. So please remember this one. This is the direct. This is the indirect. This is the direct laryngoscopy. Indirect, and this is direct laryngoscopy. Just remember this one. No, just remember the differences. Okay, more than enough. And also, guys, please remember that one. See, when the vocal cord is closed, it means, see, my vocal cord is closed. That's why I'm able to speak. Okay, na? When the vocal cord is open, then the breathing is possible. Okay, na? We speak on when vocal cord is closed. Okay, na? So that's why, guys. So when the person is continuously speaking, it means what? When the patient is suppose me, I'm continuously speaking. I need to take rest. Why? Because if I keep talking continuously, my vocal cord will be remains closed. That's why there is a breathing problem. That's why I have to take rest. Okay, like this one. Okay, get it? Next one is the all muscles supplied by recurrent laryngeal nerve, except this is the cricothyroid, which is supplied by the external branch of the superior laryngeal nerve. Okay, now done. Next one is, guys, this is the laryngomalacia. Laryngomalacia. In laryngomalacia, guys, they will give the history of this is the study is present since the birth. Okay, na? The laryngomalacia, the symptoms are increased on crying. Symptoms are increased on crying, but decrease in the prone position. Decrease in the prone position. And there is a what type of study is a inspiratory study. This is the problem with the supraglottis. You see the omega sign. Okay, na? Omega sign. Okay. Next one is the bilateral abductor palsy. Bilateral abductor palsy. See, what does see? Abductor means what? Abductor, it means it opens. It opens. What happens when the abductor muscles are paralyzed? When see, what the function of abductor? To open. But what happens here? It fails. See, when there is a bilateral recurrent laryngeal nerve damage, what is the function? Recurrent laryngeal nerve, it abducts. Okay, it abducts. So whenever there is a recurrent laryngeal nerve damage, then everyone is failed except the cricothyroid, because cricothyroid is supplied by what? Supplied by external laryngeal nerve. Okay, na? So what is the function of cricothyroid? It is the adductor. Okay, na? That's why it remains in the adduct position only, but there is no abductor to open this one. That's why all muscles are paralyzed. Only the adductor is okay. Adductor function. That's why the vocal cord remains the adducted. That's why there is a severe airway. There is a severe airway in the emergency OT. That's why the patient is lack of oxygen. difficulty in the breathing. That's why you have to do the tracheostomy. You have to do the tracheostomy. Then after, if there is a recovery within 6 months, then if there is a no recovery within 6 months, they have to do the type 2 thyroplasty. The same here, you can see here, bilateral abductor palsy, bilateral adductor. Here what happens? What happens? They are both vagus nerve damage, brachial laryngeal, superior laryngeal, all damaged. Okay, na? Adductor, adductor. Adductor is what? The adductor is paralyzed. That's why, okay, now there is a, see, it is paralyzed. That's why what is here is that, see, that's why it remains in the open. It cannot be closed. That's why you can easily see here the, that's why if it open, it means breathing is possible. But when it is open vocal cord, breathing is possible, but people can't speak. Why? The vocal cord, when it is closed, then only the speech is possible. Did you get it? Okay, na? Then what is the complication? It is called as the aphonia and the Aspergillus pneumonia. There is the treatment is the type 1 thyroplasty. Got it? Next one is the juvenile papilloma of larynx. Juvenile papilloma of larynx seen in the young child. It HPV. There is a multiple warty papillomatous lesions here. You can clearly see here. It is the history of the chronic hoarseness of voice. This is the chronic hoarseness of voice, and there is a treatment is the CO2 laser surgery. Okay, na? The next one is the TB of larynx. You can see the turban. See the turban epiglottitis. Okay, turban epiglottis, and also you can see the mouse nibble appearance. Of left vocal cord. Okay, na? Mouse nibble appearance of left vocal cord. Okay. Next one, guys, dysphonia plica. See, dysphonia plica ventricularis. There is a when there is a sound producing from the false vocal cord. Is called as the dysphonia plica ventricularis. And also, guys, see here, this is the Montgomery's silicon tracheal tube. This is one. This is used in the treatment of the laryngeotracheal stenosis. And also, please see here I think everyone knows this one, the vocal nodule, vocal polyp. Vocal nodule is nodule double, polyp is single. Okay, na? Nodule means having both sides there is swelling, bumps. Okay, na? Both sides. But here is only single. Okay, na? See, vocal nodule is also called as singers or teachers or screamers nodule. It is mostly bilateral. Okay, na? The site is very important. It is the anterior 2/3 and the posterior 2/3 here. The most common cause is the overuse of the voice. See, I'm teaching. I'm using the voices more. I'm using my vocal cord more. See, that's why in teachers, guys, they are always used to teach now. Within 24 hours, they always teach. They are staying in the school only for 10 to 12 hours. That's why when teachers are in the singers also, it's called it is the, we will see the case of the vocal nodule. Treatment is the voice rest here. Okay, for the vocal polyp, it is the benign or non-cancerous growth on the vocal cord that can appear as a blister or bump. Stalk-like growth. Mostly it is the unilateral. The treatment is the MLS, that is the microlaryngeal surgery. Got it? Okay, next one is the, guys, this is the epiglottitis or croup. See, guys, here epiglottitis is the most common cause is the strep poison than the pneumonia. Strep poison pneumonia in the immunized patient. What happens when the child is not immunized? Then it is the most common is the Haemophilus influenza. Haemophilus influenza is the most common cause of in the unimmunized patient. Okay, the treatment is the airway and the antibiotics. For the croups, for the epiglottitis, guys, you can see the thumbs up sign. You can see the thumbs up sign. See the thumbs up sign. You can see thumbs up sign. Okay, what happens in the croup? Croup is also called as laryngeotracheobronchitis. It is caused by the virus called as parainfluenza virus. Okay, now you can see the steeple sign. You see the here. This is the steeple sign. Steeple sign seen in the croup or laryngeotracheobronchitis. Treatment is the bronchodilator. Also, you can give the steroids. Okay. Next one is this is the laryngeal carcinoma. This is the laryngeal carcinoma. Just remember the image. This one, guys, this is the brace. This is the laryngeal. This is the laryngeal. The people who are the trumpet, they always blower. See, that's what see here. There is a swollen cycle. That is a swollen cycle here. So if you press here like this one, if you press here, there is a bubbling up there. See, there is a air bubbling. There is a bubbling up air. Pus will come here. Water will come like this one. That sign is called a braces. Sign is called braces sign. Okay, na X-ray you have to do with the Valsalva. With the Valsalva you have to do the X-ray. Okay, there is a what happens? There is a dilated cycle seen in the trumpet players. Okay, done na. Next one is this is the Bloom-Singer prosthesis. Okay, na remember the diagram. Okay, this is the Chevalier-Jackson tracheostomy tube. Okay, this is the Jackson tracheostomy tube. Remember this one. And guys, this is the cuffed one. This is the non-cuffed. This is the tracheostomy tube. Okay, this is the cuffed. This is non-cuffed. Okay, this is the electrolarynx, artificial larynx. This is the artificial larynx. Okay, now. So next one is guys. This is the Reinke's edema. Reinke's edema is the bilateral diffuse swelling of vocal cord. Bilateral diffuse swelling of vocal cord is common seen in smokers. Both cords are swollen. Treatment is the stripping of vocal cord because that is the decortication. Please guys see here. This one is guys. From the past 2 years, they are continuously repeating this question. Okay, this is the fossa of Rosen. This is the fossa of Rosen-Miller. This is Eustachian tube. Okay, na they are all last time they asked about what is this. This is the Eustachian tube. Last time they asked that one. Before they asked this one, they just marked like this one. And they asked that what is the what disease is common here. It is the fossa of Mullemor, the most common site for the Nasopharyngeal carcinoma. Okay, na please don't make mistakes. Okay, na next one, guys. Remember this one. See types of stridors. We have the inspiratory, biphasic, expiratory. Inspiratory, we are blockage in the pharynx, supraglottis, biphasic, glottis, subglottics, and the croup. Expiratory, thoraces, and the trachea and the bronchus. Okay, na remember the types of Thyroplasty. Okay, na type 1, this is called as medialization of cord. This is done in the adductor palsy. Type 2, lateralization of cord done in the abductor palsy. Type 3, shortening and loosening done in the puberophonia. Girls wise. Okay, na this one is this type 4 is the lengthening and tightening done in the androphonia. Means the ladies having the gents wise. Okay, next one, this is in pediatric, guys. The vocal cord is the cone shaped. This is a level of C2, C3, high level. This is the subglottis is the narrowest part. Adult hollow cylindrical C2, C3, C6, low side. There is a glottitis, the narrowest part. Are you okay with the larynx, guys? Okay, can I move to pharynx? Next one is the pharynx. Okay, now pharynx. Okay. Done. Please remember this one. So I think everyone knows this one. This is the Helmich maneuver. This is the Helmich maneuver. Again for the choking. Okay, na. Now please remember the Jenkins diverticulum. Jenkins is also called as Poulsen diverticulum. The most common site is the Killian's disease. This is the Killian's disease. Present between the thyro and the crico. Thyro and the crico-pharyngeus. Okay, now next one is the guys. Next one is the adenine hypertrophy. Adenine hypertrophy, guys. Remember that there is this is open mouth, pinch nose, high palate, rhinolalia classa. Okay, now these are the symptoms. There is the adenoid faces. It is the adenoid faces. After adenoid faces, this is the open mouth, pinch nose, high palate, rhinolalia classa. They are the symptoms of the adenoid hypertrophy. Okay, the surgery is the adenoidectomy. This is the Roach position, guys. This is in the you have to place for the surgery in the tonsil surgery. Okay, guys, see here for the JNA, juvenile nasopharyngeal angiofibroma. See, guys, for this question, you have to first of all read the question carefully. Read the question carefully. Is that here in the history they will give the male child boy, male child boy. They will mention particularly the male child or boy, and there is a recurrent epistaxis. There is a recurrent epistaxis. Then you have to blindly mark the answer as the juvenile nasopharyngeal fibroma. Okay, now there is a frog face deformity. Frog face deformity. This in the CCT. In CCT, you see in the Hallman Miller or Anderson. Hallman Miller sign or Anderson. Okay. The next one is the nasopharyngeal carcinoma, NPC. These are arises from the fossa of Rosen-Miller. I already told you about this one. Fossa of Rosen-Miller. You can see, guys, for this, guys, you have to remember this type of disease is the most common in the China. It is most common in the China. It is associated with the EBV virus, Epstein-Barr virus. Okay, now you will see the Trotus triad here. Trotus triad is a neuralgia or temporoparietal palatal palsy. There is a conductive hearing loss. Okay, now there is, remember one thing here is there is a metastatic survival. Metastatic survival lymphadenopathy is the most common manifestation in the NBC. The treatment is the chemoradiation, then you have to do the radiotherapy. Okay, first of all you have to chemoradiation. Okay, next one, guys, Quincy, guys, is called as the peritonsillar abscess. See here, remember here in the Quincy, guys, there is no outer neck swelling. There is no outer neck swelling. The chief complaint is the trismus. There is a spasm of the medial pterygoid muscle. Okay, now also the hot potash voice. That is a muffled voice. Muffled voice. Okay, now see here in the parapharyngeal abscess there is a neck swelling. There is a neck swelling. But in the Quincy there is no neck swelling. You can also see that there is a retropharyngeal abscess. You can say that this is in a pediatric emergency. Different diagnosis with the acute epiglottitis. You can see the widening of prevertebral shadow, widening of the prevertebral shadow, and okay, now it's also seen in the 2-year-old child, drooling of saliva, inspiratory stridor. Next one is this. Just okay, leave it. This is the tongue carcinoma. Remember this one, guys, tongue carcinoma. The most common site in the world is the lateral border of the tongue. But in India, it is the gingival sacca. Gingival sacca. Surte khao. Gingival buccal sulcus. Okay. Next one is the rhinophyma. Rhinophyma is also called potato nose. This is due to the hypertrophy of what? Hypertrophy of sebaceous gland. It is a non-healing ulcer with rolled out edges. Okay, now. So treatment is the carbon dioxide laser excision with the skin graft. Okay, now. Next one is the rhinoscleroma. Rhinoscleroma also called as woody nose. It is caused due to the Klebsiella rhinoscleromatis, called as Fritz bacillus. The biopsy will show the Russell bodies and the Mikulicz cells. Okay, now. The treatment is the cautery with the antibiotic combination tetracycline and the streptomycin. Okay. Next one is the rhinolith. Rhino means nose. Lith means stone. Rhino means nose. Lith means stone. There is a stone formation here. This is we'll see the chief complaint: nasal pain, headache, blockage. There is a unilateral foul smelling from the nose. There is a epistaxis. Okay. Also, guys, there is a here in the leprosy syphilis. We'll see the this is the saddle nose. Okay, now. Next one is, guys, the Leaford fracture. You have to remember the mid fracture. This is a type 1 is called as transverse fracture. Type 2 is called as pyramidal fracture. Type 3 called as craniofacial dysfunction. Next one, guys, this is the nasal septum fracture. If it is horizontal, it is called as the Jarjava fracture. Is a vertical, it is called the Chevrolet fracture. This is the nasal bone fracture. You see here nasal bone fracture of the face. Most common fracture is the nasal bone fracture. Okay, now. Next one, guys, this is the nasal endoscopy. This is the anterior rhinoscopy and the anterior rhinoscope. Rhinoscopy and the rhinoscope. Please remember this one. Next one is this one, guys. Okay, now. X-ray views of the see here. This is the Caldwell. This is the Caldwell view. This is for the occipital frontal view for the assessment of the frontal sinus. This is the water's view. This is the water's view. Okay, now this is the water's view. This is the water's view for the Nigeria sinus assessment. Okay, guys. This is the Pyrrhus. This is the Pyrrhus view. This is the Pyrrhus view. This is Pyrrhus view. Pyrrhus view always the Pyrrhus view. Always the mouth is open. Like for the assessment of the sphenoid sinuses. This is the lateral view. All sinuses are visualized. We will see the image based in the examination. Guys. Okay, this is the Wenger's line to assess the prognosis of the maxillary sinus carcinoma. This is the Weber-Ferguson's approach for the total maxillectomy. Okay, now see here, guys, with the DNS, that is deviated nasal septum, deviated nasal septum due to inferior turbinate, due to inferior turbinate hypertrophy, due to inferior turbinate hypertrophy. This is there is a symptoms of hyposmia, sinusitis, epistaxis, headache, they call it Sledder's neuralgia or anterior ethmoidal polyp. Okay, now treatment is the septal palsy. You can also see here for the DNS, guys, you have to do the Cotter's test. Okay, Cotter's test. You can see here there is a inferior turbinate hypertrophy. Okay, there is a mulberry appearance of the nasal mass. Okay, for the complication, for further complication, it will lead to the abscess and the perforation. Next one, guys. Atrophic rhinitis. It is also called ogiona. It is a wide, roomy cavities filled with crust formation. This is a merciful anosmia. Shrunken turbinate. Treatment is the alkaline nasal dosing. There is a sodium bicarbonate, sodium biborate, sodium chloride. The treatment is the surgery is the modified Young's operation. This is a rhinosporodiasis called a rhinosporidium cerebri. Mulberry-like nasal mass. It is seen in the South India mostly. It is the rhinosporodiasis. It is not a fungi. Okay, now aquatic protozoan. Treatment is the excision of the mass with electrocautery followed by the dapsone to prevent the recurrence. Next one is the guys CSF. See the CSF rhinorrhea. Okay, now this is called the halo sign. This is called the halo sign. This is the halo sign. Okay, now the most common due to cribriform plate fracture, and there is a traumatic CSF leak. The blood mixed CSF. That is in the filter paper, it gives the target sign and the hollow sign. See, beta C, it is the beta 2 transferring. It is the estimation. It is the most confirmatory test. And that there is, see here, the CSF is see here, CSF is non-sticky. CSF is non-sticky. It is like a water, and the patient cannot sniff back the CSF. See, the CSF is coming. The patient can't sniff back the CSF. Okay, now. Then you can see the other signs. You can understand that this is the CSF coming from the. Okay, now the treatment is the conservative for the 7 to 10 days with the bed rest and the antibiotics. Okay, now see here, guys, for the artery of epistaxis. It is called as sphenopalatine artery. You can see here, guys, this is called the Kieselbeck's plexus. Kieselbeck's plexus found by the this is the SP sphenopalatine artery. Sphenopalatine artery, greater palatine artery, superior level artery, anterior and posterior ethmoid artery. Both are called as the Kieselbeck's plexus, surrounded by the Little's area. Okay, now. First of all, guys, for the epistaxis, you have to pinch the nose. Then you have to do the chemical cauterization with the silver nitrate, and the next is the anterior nasal packing on both sides. After that, if not control, you have to do the posterior nasal packing. Next one is the TESPAL. Next one is the maxillary artery ligation. Last is the ECE, external artery ligation. Okay, now. Done. Next is the ear. Last one is the ear. Okay. See here, this is the retraction of pockets. Retraction of pockets is the cholesteatoma. This is the pearly white intact nerve. Pearly white. You have to remember that is the cholesteatoma. This is not the by name is the cholesterol. This is not cholesterol. Okay, na cholesteatoma. Okay, na this is the otomycosis, guys. It is the wet newspaper appearance. Okay, na due to Aspergillus niger. This is the guy. This is the grommet. This is the grommet insertion. Grommet insertion done in the glue ear called the SOM, serous otitis media. You can do the this is seen in the school going children due to the ear blockage. It's the ear glue. So you do the myringotomy, and there is a grommet insertion. Okay, now please see here, guys. This is you have to remember the ear penna. This is the this is what are the parts? What are the parts of the ear? What nerve is supplied? Okay, lesser occipital nerve supplied by blood plexus C2. This is the greater auricular. You just remember the what are the orbitemporal nerve branch of the V3 means what? Temporal. Okay, na? See, please remember the nerve supply. And also you can see the what is this? This is the otitis. This is a malignant otitis external, guys. For this, guys, always see the history. They will the patient with the diabetes mellitus, severe diabetes mellitus, also called as Colbus osteomyelitis due to Pseudomonas aeruginosa. Okay, now see this is done for the posterior superior direction, done in the for the ear syringing. It is ear syringing. Please remember here this is the cartwheel. This is the cartwheel. Cartwheel. This is the cartwheel. This is the cartwheel appearance. Okay, na seen in the SON, acute suppurative otitis media. This is the guy. This is the McQueen's triangle, suprametal triangle for the surgical landmark for the mastoid antrum. Okay, now see, guys. Next one, this one, guys. This is the acute. This is the acute mastoiditis. This is the acute mastoiditis. This is the mastoid sign. You can see lighthouse sign. You can see that this is the iron surface, ironing of the mastoid surface seen in the acute mastoiditis. Okay, remember this one. And also, guys, you have to remember the sectional view of the cochlea. This is the scala vestibuli, scala tympani, this is scala media. So they will ask the question: Resonance membrane is present between scala vestibuli and the scala media. This is Audiograms corti. Everyone knows about this one. Next one, guys. This is the BERA, brainstem evoke response audiometer. Seen in the this is done for the pediatric patient, especially in the for the meningitis patient. Okay, now for the OTO, guys, OTO, this is the acoustic emissions. OEE is for the normally. See here. Normally you have to do the OAE for the meningitic patient, NICU patient. You have to do the BERA test. Okay, now remember, most commonly is if they ask, it is the OA. For the NICU patient, meningitic patient, you have to do the BERA. Okay, now next one, guys, remember the types of the tympanometry and the type A, normal ear, ASS, sclerosis, ADD, disruption of the auricle, B flat, B serious is a serious otitis media. There is a seed or negative, it is a ET tube blocker. Okay, and also please remember the labyrinthine layers, the functions. Okay, na cochlea, vestibule, semicircular canal. There, what is the function? Okay. Next one, guys, coming to some graphs. This is the Meniere's. This is the Meniere's disease, SNHL. This is the sensorineural. This is the unilateral low frequency HNL. This is the rising. This is the rising audiogram. This is the rising audiogram. This is the rising audiogram. Rising audiogram. See, is the press bicos. This is the age rate. See, this is the sloping audiogram. Okay, na? See, men always rise. Meniere's rise. This is a press bicos means old. You have to go old like this one, sloping. Next one, guys, this is the 2K. This is the 2K nas. 2K nas seen in the. This is also called a Cahard's nas. Cahard's nas seen in the otosclerosis. See here, this is the see here notch at the 4K. So this is seen in the noise induced hearing loss. Okay. Next one, guys, I think you know this one, guys. Next one coming to the this is the Schwarz sign. Schwarz sign. It is called a flamingo. Flamingo pink. Flamingo is a bird. The flamingo pink color appearance seen in the early stage of the otosclerosis. See what is otosclerosis? There is a fixation at the steps. Okay, now see. This is a step piston process. Fixed step is replaced in the otosclerosis. Please remember this one. So, guys, for the otosclerosis, guys, remember only one thing that if they will ask at the history as there is a pregnant lady, there is a young pregnant lady, there is a young pregnant lady with the conductive hearing loss. There is a conductive hearing loss. This is the case of the otosclerosis. Remember this one. And also, guys, this is the acoustic neuroma. It is also called as sonoma. The most common is the cerebellopontine angle tumor. Okay, now it is the tumor of the eighth nerve. You can also see, guys. You can also see here the in the histopathology, guys. In the histopathology, you will see that there is a Antony A and Antony B, and there is a ice cream pattern appearance in the acoustic neuroma. The associated with the NF2. Now see, this is the cochlear implant done in the bilateral profound hearing loss. And also, please see, this is this is a Phelps sign. This is a rising sun. This is a rising sun sign. There is a Phelps sign, rising sun sign, brown sign. This is brown signs signalization. There is, please remember, there is just this is the pulse. This is the pulsating. This is the pulsate. This is a pulsating mass. Okay, pulsating mass behind the eardrum. In case of the glomus jugulae. Okay, now next one is, guys, see here. This is a managed. I think already discussed the main rise. There is a rising audiogram. It's recorded phenomena. Henberg sign positive. Tullius phenomena. This is the diplacuation. This is the see guys. This is, guys, Meniere's. See, guys, Meniere's disease is also called as glaucoma of the ear. Okay, now there is a more endol. There is a more endol. There is a more endol. There is a more endol production. Okay, now. It's otoscope. I think everyone knows. So thank you very much, guys. So guys, please do watch all my videos. Please support me also. And thank you very much. And salamat, धन्यवाद सभी को. ठीक है, मिलेंगे बाद में in the next video. Please, guys, after the exams, guys, after passing, please just message me that भैया मैं पास हो गया, तो I pass. Okay ना? Thank you very much, guys. See you soon.